So the latest data from Centers for Disease Control indicates that we're entering the peak of COVID, flu, and RSV infection season right now.
And nearly 40 states, including New York, are reporting high or very high respiratory illness infections. Now, many of us don't need the data to tell us that, at all. I'm still recovering from some sort of virus, which knocked me out last week. So joining us this morning is New York City Health Commissioner, Dr. Ashwin Vasan, with how the hospitals are handling the surge. So good morning, Dr. Vasan.
Good morning.
Good morning.
Thank you so much for being here. So the COVID numbers are on the rise, correct?
Yeah, we're seeing a rise for COVID and flu. We think we might be approaching the peak, certainly on COVID, but it's not too early to tell. RSV, we think we're on the downward trajectory, so that's great news. We hit our peak back in December. But, the advice to New Yorkers remains the same. Get vaccinated for COVID and flu. Get updated. Every year we have to update our COVID immunity and our flu immunity. If you're a member of one of those high-risk groups, age over 60, you're eligible for the RSV vaccine. If you're a young parent of a young child, talk to your pediatrician about whether the monoclonal antibody for RSV. Stay home if you're sick. Wear a mask in crowded settings. Get tested often, get treated early, and we have all sorts of options and tools and information to keep ourselves safe.
I think that way, people's interest got peaked last week. We expected the surge, right? Because this is what's going to happen almost yearly now with the holiday. Post-surge, you're going to see the numbers go up. We've known that just from the last couple of years. But the mask mandate is now back at hospitals. Is that just the beginning, and what was the logic behind specifically hospitals?
Well, we have to protect high-risk settings. Not only are there high-risk people, patients, people who are sick, in those settings that we want to protect and keep healthy, we have a high-risk and a high-priority workforce. So we saw during Omicron 2 years ago that our nursing workforce, our doctors, our social workers were decimated by COVID, and we saw a lot of absenteeism and as a result of illness. We can't afford that in our healthcare system. We're not seeing any concerning data that suggests our healthcare system is in any way overwhelmed. But by putting masks on in patient care settings across our hospital systems, that's a sensible choice to keep people safe and keep our workforce safe, our essential health workers.
Now, the last time you were here, we were speaking about the new variant, the JN1 variant. Is that the main culprit then this time around?
Yeah, we see JN1 has outcompeted the rest of the previous variants and now is the dominant variant here in New York and across the country. There's no data that suggests that it's in any way more severe or causing more severe illness, but it's definitely outcompeting those other variants in terms of transmissibility. Okay,
but, sorry, just back to masks for a second. Are you looking at any other areas to implement some kind of mandate, or is it going to stop at hospitals?
Well, the state health commissioner and I just put out a statement yesterday, I believe, about encouraging institutions, high-risk institutions, to put back mask requirements in their facilities. Nursing homes, congregate settings like shelters, our correctional system, and of course hospitals and healthcare facilities, because we need to protect those vulnerable people who get services there, but also the workforce.
Okay.
So here's the confusing thing. I got tested for everything, flu, COVID, RSV, and came up nothing. So I'm still wondering what it is I had. I was out for 3 days, had no voice. So how long should I, or anybody that suffers from the same symptoms, be wearing a mask? And should be wearing masks?
Well, good news is, let's start with good news is you're getting better.
Yes.
The other piece that New Yorkers need to remember is that we've always had respiratory viruses.
Yeah.
And they haven't always been these three. There's a lot of other viruses out there that we face every single year. The routine cold, they can cause flu-like illness and cold-like symptoms. So you might have just gotten one of those viruses for which we don't have a test, nor do we really need routine testing, because you self-recover, and we know a lot about that. So that's one thing. So you may not have had, you probably didn't have any one of those three, these viruses. In terms of mask wearing, so if you have to go to work, or if you have to be in outdoor setting, crowded settings, and you're having some symptoms, if for whatever reason you're an essential worker, you can't afford, you have childcare issues, whatever it is, wearing a mask makes sense, right? High-grade masks are better than surgical masks. But if you have lingering symptoms like a cough or sore throat, even if you don't have fever or the other viral symptoms of body ache and fatigue, it makes sense to keep wearing a mask for a little bit of time to make others comfortable, to make yourself comfortable, and just to make sure you reduce the risk. But to be honest, your transmissibility isn't really high
Yeah.
because you've passed that infectious period.
But here's the one concern that I do have, because a lot of people are saying, I got the COVID vaccine, I don't need to get tested. And then you're hearing, oh, maybe it's just a cold, I don't need to get tested. When should you decide, you know what, maybe I should get tested?
I think if you have fever, if you have cough, if you have shortness of breath, if you have any of those viral symptoms like sore throat, stuffy nose, fatigue, get tested for COVID, get tested for flu. And see, you can eliminate those if they're negative, and just and accept that it might just be one of those routine winter viruses.
How long are you going to keep that mask mandate at the hospitals?
I think we'll look at the data. We always revisit the data week after week, day after day, to assess whether those requirements make sense. Obviously, it's a mandate in our public hospital systems. You're seeing different institutions take slightly different approaches, strong recommendations, requirements.
Yeah.
We employ things like mandates and authority in times of real emergency and need, and we're not seeing an emergency right now. We're just seeing like a need to evolve and adapt to the data.
Gotcha. Dr. Vasan, appreciate you being here this morning as
Always
always.
glad.